I found very early in my career that there were a lot of things that I knew that I could do as a pharmacist, but there were some barriers in the way that were slowing down how I could relate to my patients and what I could ultimately do for them. Some of them being legislative, some of them being technology based. Certainly there's some of the compensation and reimbursement issues around that. And I've always been an individual that said, I'm not going to complain about something unless I'm going to be willing to step forward and do something about it. And certainly working on advocacy role is a large role to play for that. And certainly my involvement with CPhA is stemmed from that. Well, I think one of the issues that is first and foremost in front of us in Canada is seeing the changes that we're having on the financial compensation models. Certainly the governments have been recognizing that they want to move away from the product-based reimbursement issues, and they're starting to recognize obviously that pharmacists are bringing a lot more to the table in terms of the service component, and that's obviously where our next challenge is trying to make those service components publicly funded, and obviously we have to deal with some issues on the privately funded sector as well. So that's one of the issues. Second issue is some of the tools that pharmacists need to improve the efficiency of the care they're providing, especially around the documentation of the clinical services that we need. Pharmacies are such an accessible healthcare professional in the healthcare system. We need to not lose that, and in order to be that efficient in terms of changing to some of our roles that the government and certainly the public expects from us, that's where obviously we'll see some need to provide further infrastructure and change around that front. And that's technology on the documentation side of things, and also the technology to make sure that pharmacists have the access to the health resources and the drug information resources that they need at the time that they want to have it. And certainly that's a role that CPhA is playing for pharmacists with eTherapeutics Plus, and what that means for us as practitioners to make sure we're practicing evidence-based medicine. I'm not sure what the one best solution is, but I think until you sit down and have those discussions and look at the healthcare delivery model and entire system, that you're not going to get to the proper solutions that you do need to accomplish. We have a lot of funding buckets and different silos of healthcare delivery. We need to open that up and look through it and on a full scope, rather than focusing on just the drug side of things or physician services or hospital services. The continuum of care and how we deliver healthcare in Canada has to look at the full funding model, and we have to find what's the most efficient way to deliver the care that patients need in a timely and accessible manner. And pharmacists want to be part of that discussion. We want to be at the table and find those solutions, because we do have to deliver care to our patients. That's why we got into pharmacy in the first place, is we wanted to deliver that care, and there's got to be a rational way to make sure that we are having the way to actually deliver that infrastructure, deliver those services to the patients. When it comes to pharmacy technicians, I would say that a majority of pharmacists, at least the pharmacists that I've spoken to, definitely see them as a huge asset for the delivery of pharmacy services in the community and in the hospital and in other centers. We have to find a way to be able to the pharmacists have to find a way to be able to spend more time with their patients, and you still need to ensure that you have a safe drug distribution process in place. And pharmacy technicians play a huge role on that in order to make sure that we have qualified individuals keeping that drug distribution component and part of the system safe and effective. And again, still be able to find ways to free up time for the pharmacist to spend more time focusing on ensuring the medication therapy is appropriate for the patient, and also very importantly, ensuring that the patients are taking their medication appropriately and monitoring that. And without technicians or some sort of way to make sure that drug distribution process is safe and in place, we aren't going to be able to keep up with the demands that are occurring in the healthcare system. Absolutely. Certainly I look at our profession as a profession that's, again, dedicated to the care that they want to provide their patients. And there's different ways to provide that care. And I think certainly when we look at opportunities for all healthcare practitioners to try to provide the proper care and do the best that they can for the patients, we all have to think outside the box. We have to be willing to take some chances to make sure that we're providing the quality care that our patients require, and find different ways to collaborate with different healthcare practitioners and different caregivers that exist within the environment. And whether it be community or the acute care, working in with long-term care and extended health services, we all have to be willing to think outside that box and focus on the opportunities that best serve our patients. There's a lot of shop talk around the dinner table type thing, but certainly the nice thing about it is we have a lot of shared views and visions as far as where pharmacy is going and where the practice is going. So it's good additional enthusiasm for each other to kind of, when you have those tough days, to have somebody to bounce some ideas and they know what you're going through on that front. Mm-hmm. And the same way to share some ideas as far as what's the best way to keep doing what we want to be doing in terms of helping our patients. Not a lot of hidden passion or talents on it, but my focus is on my family. I do have a young family that certainly my professional role and my role on the volunteer capacity with Canadian Pharmacists Association does take a lot of my time, but I enjoy spending the time with my kids. I like to coach my son's hockey team and soccer team and make sure that I'm able to participate in as many things for my daughter, whether it be the dance side of things or her soccer participation. So they are my free time at this point in time in my career.